Hello everyone, good morning. So today I am going to discuss about an interesting topic on rheumatoid arthritis. Rheumatoid arthritis is actually a chronic inflammatory autoimmune disorder that affects the lining of basically the joints of the body, and it can result in inflammation and swelling of these joints, and then eventually can cause also other body systems to get affected, such as the skin, the eyes, lungs, heart, and blood vessels. Now, the autoimmune disorder, since it is affects the whole body tissue or attacks your own body tissues, so it may result in basically swelling and painful swelling, and that could lead to either bone erosion or joint deformities. Now, what this inflammation that is associated with this is what can damage also the other body parts. So, this what are the signs and symptoms of this condition? The first thing that the patient usually comes with is tenderness and swelling of the joints. Then there is stiffness of the joints, which is worse from motion or activity, and it's usually worse or in the mornings. Then the patient may also develop systemic symptoms such as fever, loss of appetite, and fatigue, and weakness overall. Also, there may develop in the skin certain lumps or redness, and in some cases, these lumps may be found on the fingers with the swelling as well. Then, patient may also develop a dry mouth and eyes, and sensation of pins and needles. So these are basically the systemic symptoms that appear when the body starts gets affected by this condition. Now, in the early cases of rheumatoid arthritis, it usually affects the smaller joints first. So joints that attach to the fingers to the hands and the toes to the feet. So those are basically the organs that get affected first. And as the disease progresses, these symptoms may spread to other parts of the body, such as the wrist, the ankles, the knees, elbows, hips, and shoulders, and mostly they occur in the same joints on both sides of your body. नाउ अब बात करते हैं इसके कॉजेज़ के बारे में. सो क्या कॉज है जो रूमेटॉइड आर्थराइटिस कॉज करता है? सो इन दैट केस वी हैव सीन दैट द genetic component is usually seen associated with this condition, but we don't know what actually starts this process. Now, this gene component does not actually cause the condition, but it makes the body susceptible to certain environmental factors and infections from bacteria and viruses, which in turn results in the development of this condition. Now, what are the risk factors? सो रिस्क फैक्टर्स में कौन से फैक्टर्स है जो इस कंडीशन को एग्रावेट कर सकते हैं या फर्दर इंक्रीज कर सकते हैं? सो उन केसेस में इट हैज़ बीन सीन दैट ये कंडीशन मोस्टली फीमेल्स में देखी जाती है और मोस्टली मिडल एज पर्सनस में मोर कॉमनली ऑब्जर्व होती है. Also, the patient who have family history of this condition are more prone to this condition to develop. Then persons who are taking lot of smoking or doing a lot of cigarette smoking, in those cases, or those who are very obese, in those patients also, because of their diet and other conditions, these conditions, the patient may develop this condition. Now, what are the complications that are associated with this condition? Now, if we talk about the complications, they appear later in the later stages of the disease. But before we go into that, let me also tell you about the diagnostic features, or what are the confirmatory diagnoses for this condition. So in that case, first we go for the blood test to see if there is any inflammation or infection in the body. So general CBC profile can be done. ESR can be done to see if it is a chronic infection or an acute infection. Then once that is verified, then we can go for the rheumatoid arthritis factor, which is an antibody test that checks the presence of this RA factor. And if that is positive, then it is a confirmation that this person is suffering from rheumatoid arthritis. Besides that, we can also do some x-rays of the body or the affected parts or joints. The chest x-ray can be done, the x-ray of the hands, the bones, and can be done. And then this also after that MRI scan and can be done, or we can do other types of scans, MRI scans, to see if there is any bone erosion between the joints, how much damage has been done to the joints, and if there is any other conditions that are associated. So this was the confirmatory diagnostic tests that can be done to confirm this condition. Now for the complications, the patient who suffer from rheumatoid arthritis usually may go into developing osteoporosis. So this is a condition that is usually seen obviously after middle age, and in this the body bones, they get weakened and the patient becomes more prone to fractures. Also, the rheumatoid nodules, which are bumps of tissues that form under the skin or around the pressure points, are seen in patients who have this condition. So usually these bumps are seen on the pressure points like the elbows or anywhere in the body, such as the heart and the lungs. Now, dry eyes and mouth. It is called Sjogren's syndrome, and it is a disorder that decreases the presence or the amount of moisture that is present in your eyes and the mouth. So persons who have RF or rheumatoid arthritis usually have this condition also. Then these persons, obviously, because their immune system is compromised, so they may get infections more frequently than normal individuals. Then also it is seen that the patient have abnormal body composition. That means the percentage of fat to the lean mass is often higher in people with RA. Now, even in those who have a normal base BMI or the body mass index, those people also can still have a large proportion of fat to lean mass if they are suffering from this condition. Then there are persons who may have carpal tunnel syndrome, which is basically the affections of the wrist joint, and there is inflammation and compression of the nerves that can affect your fingers and hands. Then persons may also develop heart problems, that is, there may be increased risk of hardened and blocked arteries. Now, the lung tissues may be affected, that is, the increased risk of inflammation and scarring of lung tissues, which can lead to progressive shortening of the breath. Now, lymphoma may be seen also in these patients, especially if it is a more chronic condition. Then they may develop blood cancer or lymphoma, where in the lymph systems of the body, and this may further aggravate or complicate their conditions. So now let's discuss about what is the management of rheumatoid arthritis and how we can manage it both in general and with medicines. So firstly, the medicines that can be given are such as homeopathic medicines like causticum, which is useful in cases where there is bone deformity or joint deformity, painful joints especially, and if the history of grief or sorrow is present in the patient which triggered this condition, then this would be a very good medicine. Then there are some other medicines such as quicum, Staphylococcus, then xylophyllum, and many other medicines that can be given according to what the patient is suffering from, what their symptoms are, and what their general individualistic joints are affecting. In the general management, if patient is obese, then we have to check whether their diet is okay or not. We need to regulate their diet, especially avoiding spicy and fatty foods. Then also advising them to get into a more active lifestyle, such as walking or doing breathing exercises or yoga. They can also be told to decrease their weight and also to lead a more active lifestyle. Then, in patients with dry eyes or mouth, we can provide some the drops that can actually decrease the dryness of this condition. So, this was a general information about the management of rheumatoid arthritis. And in case you liked the video, please like and share, and have a great day.